Good evening, listeners. Welcome to Views on Health. As always, a pleasure, and tonight more so, to have Dr. Shehan Silva with me on the program. And I'm sure listeners will recall that we had Dr. Shehan Silva speak on falls in the elderly last time around. And tonight is going to be another topic in his capacity as a consultant physician. But first, he is a senior lecturer in medicine, Faculty of Medicine, University of Sri Jayawardenepura, consultant physician, Colombo South Teaching Hospital, and the honorary secretary of the Geriatric Medicine Association. A warm welcome, Doctor, back to SLBC and our studio.
Thank you.
And for the information of our listeners, the topic under discussion tonight is venous thrombosis. Over to you, Doctor.
Good evening. It's a pleasant encounter to be back again. And the discussion today will be centered on an important area in medicine, which is called venous thromboembolism. I'm sure that you may be wondering what this long word is. But in fact, this is in layman's language, clots in the veins of a person's body. And what are we dealing with mainly? We deal with clots involving the legs and clots involving the lungs. Veins, as you know, are a low pressure system. So in a low pressure system, there is stasis, or there is always stagnation of blood. And this gives rise to formation of clots, and the risk of clot formation increases as one encounter various medical problems. This is not so much common in our population, especially in Sri Lanka, but if you travel to the west, or if you are a person who has Caucasian genes or white genes, you are at a high risk of developing deep vein thrombosis as well as pulmonary embolism. But since of late, we have seen that more and more persons encounter clots in the veins as well as clots in lungs. So this, I think, is a timely topic. So what are we dealing with? We deal with life-threatening complications leading from thrombosis of the veins. So you may wonder how a person would get venous thromboembolism or deep vein thrombosis. We call it as DVT or a pulmonary embolism. The fact that your genes do really take a role in this. We being Sri Lankans, we being people who have a darker skin compared to our counterparts in the West or Europeans, have a low threshold of developing this because we are protected. We don't have genetic problems dealing with deficiencies of the various chemicals that are needed for clotting and clots to be dissolved in the body. So genes do take a role. And also various familial conditions can give rise to venous thromboembolism. These are quite rare in our circumstances. But when it comes to our population, what is more common and what is more important are conditions like immobilization and malignancies. We'll talk about these as we go on. So last week we spoke of falls, especially falls in the elderly. And as I mentioned, falls give rise to immobilization, being confined to a bed for more than maybe 2 or 3 days, sometimes even months. This put at risk of stagnation or stasis of blood in the veins, giving rise to formation of clots. So other than falls, how does immobilization cause venous thromboembolism. The other fact is that a person who may encounter a surgery, maybe a hip surgery, a pelvic surgery, or even a leg surgery, maybe a fracture correction, putting somebody into a plaster cast and being confined to a bed will put that person into venous thromboembolism. I mentioned about malignancies. So how do malignancies bring a risk into this? So there is a phenomenon called paraneoplastic syndrome, where malignancies or cancers have a feature where they secrete various chemicals that may clot blood. So, for instance, if somebody has had a malignancy of the ovaries, maybe a malignancy of the bowels, maybe a malignancy of the womb, all of those conditions can give rise to venous thromboembolism. There are also, the research has also shown that additional risk factors such as obesity and smoking makes an important contribution to the formation of venous thromboembolism. As you know, our population is a population that is changing its lifestyle, and we are having the black death of the new millennia, that is diabetes and this entity called metabolic syndrome, where we are not active. Our dietary changes have, lifestyle has changed, and our diets have become of a more refined diet, and which has more sugars and cholesterol, which gives rise to obesity. And the fact that if somebody has a BMI of more than 29, that brings an additional risk of deep vein thrombosis. Any person who has a propensity or to develop hypertension or blood pressure, which is uncontrolled, that also put at risk of developing deep vein thrombosis and venous thromboembolism. Another factor is if somebody is a constant smoker. Again, nicotine and the tar that is there in the smoke can give rise to pro-clotting mechanisms that further gives the risk of developing these venous thrombosis. Well, you may wonder, is it only in the late middle age or elderly persons who develop venous thromboembolism? No, this is not so. You see this also in young females as well. And who am I talking about? These are persons who may be taking contraceptive pills without medical advice. People who are on hormonal therapy. People who may be pregnant in later stages, or who have delivered children immediately within 6 weeks duration. So all of these people have the risk of developing thrombosis. And I need to mention that it is essential to note that there is a condition, especially in pregnancy and in the early maternity phase, where females can have sudden onset headaches, which may be a sign of a clot that is present in the veins of the brain. Not the arteries as you would see in a stroke, but in the veins. More importantly, another factor that comes into play with venous thromboembolism is long haul flights and long distance travel. Well, traveling abroad seems to be an unrealistic thing at the moment in our context. But even traveling to a long distance place, let's say if you travel from Colombo to Jaffna overnight in a bus, seated in a singular position without movement, again there is stagnation of blood pooling of blood in the veins, which gives rise to the risk of developing clots. Well, you would wonder how you can detect this phenomenon of venous thromboembolism. Well, deep vein thrombosis occurs with all those risk factors coming into play, and patients will present with leg swelling, maybe within few hours or even over days, where most often you see this in one single leg. And this will be indeed painful and tender, and there will be a lot of heat, warmth, and also may even note that this person may be having redness in the skin. You would have heard of a condition called cellulitis, which is an infection of the skin of the legs. Well, deep vein thrombosis can mimic in that way, and it is essential that you do not neglect the fact that you may be having a deep vein thrombosis. In particular, especially if the whole leg is affected, or the, let's say, knee down or ankle down, if the limb is swollen, you may be having a venous thromboembolism. So please do not neglect yourself and just gulp in antibiotics. Go and see a doctor. We come to venous thromboembolism, the other part of it, pulmonary embolism. So these are clots that are present in the lungs. So how do these manifest? So the mere fact that somebody has a deep vein thrombosis in the legs may be at a risk of developing a breakage of the clot, which can let the clot move up to the lungs. So how do they present? They may present with sudden onset shortness of breath, difficulty in breathing. They may be hungry for air, or they may be even having sudden onset chest pain, just like an heart attack. So this is an important diagnosis that we need to see as doctors. When somebody comes with chest pain, sudden onset chest pain, we often wonder whether the person has had a heart attack, but there is also always a possibility of having a thrombus or a pulmonary embolism in the lungs. So this is how it manifests. And rarely, and in a very unlucky manner, you would see that suddenly a person might become very, very short of breath, and the patient might collapse and even die. Sudden cardiac arrest. This could be because of a massive pulmonary embolism. So these are things that you need to wonder about. So if you are at a risk, if you are immobilized, if you are confined to bed, if you have had a fracture in the recent past, if you had a surgery of your bowels or your womb or in your pelvis, or a fracture again, or if you are a smoker, if you are obese, or if you have a tendency, a familial tendency to develop clots, if you are taking hormonal drugs like contraceptive pills, etc., you are at a risk of developing such problems. So it's essential that you present to a doctor when those signs and symptoms are. So a doctor will do various tests. This includes, if it's a clot in the legs, the doctor would order a scan, ultrasound scan of the legs to see whether there is an evidence of a blockage of the veins. If the doctor thinks that it may be a pulmonary embolus or a lung clot, the mere fact by doing an ECG, it might prompt the doctor to think that this is rather a clot in the lungs rather than a heart attack. Well, there are other tests also, such as CT scans, that can be done in that circumstances. So it's essential that these things are done by the medical team. And let's say if one develops a clot with all those risk factors being present, then it becomes very simple and you need not uh, investigate further other than doing those tests that I mentioned. But let's say if somebody develops a clot without any risk factor, not even a long distance travel, not being even a smoker, not being even having obesity, then it is essential that the doctor, the medical team digs out and find the cause of the reason for a clot or an unexplainable clot that has uh, presented in this patient. So these include blood tests, various blood tests um, to check on the levels of the clotting factors and also the thickness of the blood, which the doctor will order when and as required. So now you may wonder how we treat a patient who develops a venous thromboembolism. So the most important mode of treatment is to make the blood less thick and make it less clottable. So how do we do that? In the early phase, the patient may be given injections to the skin, just like the way that insulin is administered. This is called heparin, which will get the blood more supple and less thick. And immediately the doctor, along with the heparin, the injections, may start on tablets. You would have heard of an agent called warfarin, which is a drug that has been used for many decades. It's a drug which actually prevents clot formation. So on the first day of diagnosis itself, it will be prescribed that the patient needs to be on warfarin, and the dose will be changed as time goes on. And how do we do that? We will have to repeatedly check on a blood test called the PT-INR, which is an indicator of the thickness or the coagulability of blood. So if we tend to keep the blood 2 to 3 times less clottable compared to a normal person, and thereafter warfarin dosage will be adjusted. It will be increased or decreased depending on the value of the INR. So this is a cumbersome thing, as there will be repeated blood tests, maybe daily in the first few days. And once the intended range of 2 to 3 times the normal range is achieved, then as one goes on, it will be weekly or even monthly, and the warfarin will be adjusted accordingly. Thereafter, usually the patient is kept for about 3 months on warfarin. Well, other than warfarin, there are newer drugs that are there in the market which do not need this assessment of this INR test, but certainly the heparin will need to be, the injections will need to be bridged with warfarin for a period till the action of these drugs are taking into place. I would like to also mention some facts about warfarin. It is essential that you have the utmost compliance when you're taking warfarin. You need to take it every day at 6 p.m. and you need to make sure that a period of at least 1 hour both ways, from the time of taking the drug and the time before taking the drug, that you are not consuming any food items or any beverages. But you need to take it with a full glass of water. It is essential that these doses are adjusted according to the medical advice that you are given, and that compliance or continuity is maintained in the strictest fashion. It is essential that when somebody is on warfarin or on any other blood thinner drugs, like what I mentioned, the newer drugs, that people do not consume green leafy vegetables. Why is this? Because, as you know, green leafy vegetables contain a fair amount of vitamin K, and vitamin K is a crucial factor for the clotting process. So by giving additional vitamin K, you are going to tamper with the effectivity of the drug that the doctor has prescribed. So these things are essential when you take warfarin. Well, the take-home message with regards to venous thromboembolism is, how do we prevent it? We are lucky as a population that this is not so common in our community, but we see this happening more and more in hospitals. So if you are traveling on a long journey, it may be a long haul flight or maybe a long distance travel in a vehicle such as a bus, need to have frequent breaks. Roll your feet, roll your thighs, bend your legs frequently so that the blood doesn't get stagnated. It is essential that you consume adequate amount of liquid water when you are traveling. In particular, when you are traveling in an aircraft, in a pressurized cabin, without your knowledge, you tend to dehydrate yourself. So it is essential that you hydrate yourself very well so that the blood doesn't become sticky. It is essential that you control your weight, you become more active, exercise, and cut down on the fatty stuff and the refined sugars that you consume from your diet, so that the weight is tackled. Adequate amount of exercise is essential. If you are a smoker, you need to stop smoking. Not cut down, but stop smoking. If you are taking a hormonal drug, it's essential that you review yourself with your doctor whether the continuity of this hormonal drug, such as an oral contraceptive or a hormone replacement therapy in menopause, is done. Well, let's say you undergo a surgery. It is essential that you need to make sure that while you are being immobilized in bed, that you need to rock your legs often. You need to have a little bit of activity in your legs and your feet. It is essential that you wear, we prescribe that into our patients, this graduated compression stockings where they occlude the veins on the superficial area. And also sometimes medical teams or surgical teams prescribe prophylactically or preventative doses of heparin as injections to counteract with this deadly phenomenon.
Thank you, Doctor, once again. It's been a very, very detailed and lucid explanation of venous thrombosis. You said that it's not that common in Sri Lanka. However, is it more the males or the females who are affected, number one? And about what age group, approximate, that you see more cases?
Well, you see it more commonly in females because of the fact that the estrogen, the hormone, the female hormone, has a tendency to make the blood thicker. That's the very same reason why a person who takes the oral contraceptive pill or the hormone replacement therapy have an increased propensity to develop clots. But having said all of this, males also can have this in their lifetime. The mere fact that smoking comes into play, and also obesity. The other fact is that as as one age, in particular males as well as females, the effect of the androgens, the male hormones that are there in the youth, tend to go down, and the effect of estrogen comes up to the surface, and this gives rise to the tendency to clot. So it's not a disease of a particular sex, and also the fact that as one age, all these things take an important role. The immobility, the ability to move, the other medical problems such as menopause, having various arthritic or spinal problems or pelvic problems in life. So all these things take a role and increase the risk of developing venous thromboembolism.
And finally, doctor, question, what are the other ailments that can impact on this condition? You did speak of like smoking. It's not an ailment in that sense, but those are habits. But like say if you say diabetes, high blood pressure, a high level of cholesterol, you did speak of obesity, of course. Would those impact? They do impact on health, but would there be a further impact on something like venous thrombosis?
Yes. So other than diabetes, high blood pressure and cholesterol also take an important role, although not singularly, but they all occur together. As you know, when it's the same way as one stalk comes and lands on the roof, it comes with several other stalks. So in the same way, all these diseases make a key role. It's a concept of multimorbidity. Many diseases causing many problems.
Thank you, doctor. It's again, it's been a pleasure having you, but certainly I wish I could have gone on a little longer with you on this particular topic, but unfortunately time has caught up with us. So we place on record our very grateful thanks to you, Dr. Shehan Silva, Senior Lecturer in Medicine, Faculty of Medicine, University of Sri Jayewardenepura, Consultant Physician, Colombo South Teaching Hospital, and the Honorary Secretary of the Geriatric Medicine Association. You're wearing a number of hats. Thank you for sparing a valuable time to come here and be with us on the program in the midst of this hectic schedule that I can see for myself that sort of encompasses your life. Thank you so much, Doctor.
Thank you.
My thanks also to Manjula Senviratna for technical assistance. Thank you, Manjula. I'm Fatima Razi Khader saying good night and hoping to catch you next Monday, same time on Views on Health.